Dr. Michael Barnes here, board certified psychiatrist. Today we're going to talk about a group of medications called SSRIs, which are antidepressants that treat many other things, such as anxiety, panic disorder, PTSD, and OCD, and even other things. What they do is these medications essentially increase a chemical in the brain called serotonin. And when serotonin goes up, people tend to feel better. Keep in mind, for some people, it can take up to 4 to 6 weeks to work. There are numerous different serotonin medications, all which have some slight differences between them, and it's up to the psychiatrist to work with the patient to figure out which one is the most appropriate. Let's talk about the risks and benefits, starting with the benefits. Here we go. First things first is its safety profile. I would venture to say that this group of medications is probably the safest group of medicines that we have in psychiatry, especially when you compare it to other perhaps mood stabilizing agents or antipsychotics, for example, or even some older antidepressants. As mentioned before, it treats a wide variety of disorders. Medicines also tend to have pretty flexible once daily dosing. Let's now talk about the risks. Right off the bat, these medications do come with a warning that says that in some folks who take them, suicidal thoughts can increase. Now, this is a very controversial, misunderstood warning, and I'm going to make a video just on this topic. But for now, you should understand that just like with any medication, you have to monitor for suicide extremely carefully. Otherwise, in my experience, these medications have actually been shown to decrease suicide risk. Next, I'll mention common, what we call classic serotonin side effects. So, fun trivia fact, most of the serotonin in your body is actually not in your brain, it's in your belly. So when these medications first start working, you can get a little bit of upset stomach or headache. Luckily for most people, none of this occurs, and when it does, it tends to go away. Lastly, I'll mention that these medicines can sometimes cause sexual dysfunction, such as low libido or difficulty achieving an orgasm. So in conclusion, if you struggle with anything that we mentioned earlier, you should at least ask your doctor if any of these medicines could be appropriate for you.